Everyone has experienced an itch before, and sometimes it can drive us really mad just scratching away. In this video, we're going to explore some of the common causes for itch and what we can do both at home and in dermatology to treat it. Hi friends, welcome back to my channel. My name is Chris and I am a dermatology trainee currently working in the west of Scotland, and on this channel I share my life experiences working in dermatology as well as life in the UK as a foreign medical graduate. So why do we itch? Now, there are many reasons why people itch, and it is important for us to find the exact cause for our itch in order to nip it in the bud and treat it appropriately. One of the most common causes of itch is dry skin, also known as xerosis. This can be due to many triggers such as external factors like low humidity and cold weather, as well as internal causes ranging from having a poor diet or malnourishment to genetic conditions like ichthyosis vulgaris. Another common cause of itch is eczema, and this gives rise to dry, itchy, inflamed skin. And there are many types of eczema such as atopic eczema, nodular prurigo, discoid eczema, and so on and so forth. There are also other inflammatory skin conditions causing itch, such as the very common lichen planus, where you get this raised, itchy, purple to red papules, and they are mainly found on classic sites like the wrists, lower back, and even the ankles. Urticaria is also another common cause of itch, and it typically presents as really raised, itchy skin, also known as hives or wheals, and they can be associated with swelling of the lips, the eyes, and mouth, also known as angioedema. We also encounter infections like insect bites, scabies, and lice, and they have unique features that we look out for when diagnosing them in dermatology. Other causes include drug rashes such as penicillin antibiotics, as well as systemic conditions such as problems with the kidneys, the liver, and even the thyroid. And in very rare occasions, you get the itch as the only presenting complaint with underlying malignancy or cancer. So how do we manage the itch? Well, number one, treat the underlying cause. So for example, if the itch is due to urticaria, we can treat it with regular antihistamines. And if it's very bad eczema or psoriasis, sometimes we may require topical steroids to calm the skin down and control the inflammation. If the itch is due to an underlying systemic condition like a thyroid problem, kidney problem, or even liver issues, sometimes treating the underlying cause can lead to a reduction of the itch symptoms. And of course, other than treating the underlying cause, there are ways we can do at home and in dermatology to treat supportively. Use a good moisturizer and a cleanser regularly. Now, dry skin often causes or exacerbates the itch sensation, so make sure you use plenty of emollients or moisturizers to hydrate the skin and maintain the skin barrier function. In dermatology, we often prefer using an ointment which has a higher oil to water ratio content rather than a cream or gel. This means that the ointment will last longer on the skin surface, and the best time to use it is actually right after a shower or bath. Now, there are plenty of moisturizers out there on the market, and it really doesn't matter what you go for as long as you like the texture and feel of it and it doesn't have any fragrance. And in dermatology, we prescribe Vaseline type ointments like white soft paraffin, liquid paraffin, and hydromor ointments. A gentle cleanser can also be used during bathing and showering because normal soaps contain quite harsh ingredients that can be quite irritating and drying to the skin. And in dermatology, there are various soap substitutes we can go for, such as QV Gentle Wash, hydromor ointments, Apoderm ointments, and even Dermol 500, which has antiseptic properties, very good for secondary bacterial infection. And sometimes people also add oats in their baths to help soothe their skin and calm the skin down. The next thing you can do is to keep your skin cool and the surrounding temperature humid. You can use something like a cold compress, a wet cloth, and even an ice pack to cool the skin down and reduce the itch sensation. Taking a cool shower in lukewarm water and avoiding hot baths can be quite effective too. Another tip is to store your moisturizers in the fridge to keep it nice and cool. Keep your bedroom cool and don't sleep with heavy or heat-retaining clothing. Avoid extreme temperature changes and consider using a humidifier in your room because low humidity can actually cause dry skin and further itch. The next thing you can do yourself is to avoid anything that can cause further skin irritation. And this can include things like clothing made up of synthetic fibers like nylon and polyester, and instead opt for fabrics that contain natural materials such as cotton, bamboo, and silk. Another option is to wear loose-fitting clothing because tight clothing can sometimes cause further friction and itch. The next tip is to go for creams with anti-itch properties. So you can consider using creams like Calamine Lotion, which is a pink thick cream that contains active ingredients like zinc and ferrous oxide. Calamine lotion has antiseptic, anti-itch or antipyretic properties, but I wouldn't recommend using it on a daily basis because it can dry the skin out and cause further inflammation. Other creams containing menthol and camphor is something you may wish to consider using because it helps cool the skin down. You can also consider creams containing topical anesthetics like lidocaine and pramoxine, as they can be quite useful for neuropathic itch, which is when the nerve cells in the brain and spinal cord aren't working as normal. Another cream you can try would be Urex cream, which contains the ingredient crotamidone, and this is actually quite helpful for itch secondary to infections like scabies and insect bites. I have listed some of the products containing anti-itch ingredients in the description box down below, and you may wish to check them out. There are of course creams containing antihistamines in them, such as doxepin and diphenhydramine, which you may also consider using, especially for histamine-mediated insect bite itch. And if this doesn't work and your body continues to be itchy, I think it is quite important for you to seek out your local dermatologist, who may wish to perform more investigations to find out what the underlying cause is. At the same time, they can offer other treatments like phototherapy or light treatment, as well as certain anti-seizure, antidepressant medications, which have actually worked quite well for very severe generalized itch. The last thing you can do is to try to avoid scratching at all costs. This is because of the itch-scratch cycle, whereby the more you scratch your skin because it's itchy, the more itchy it becomes. Here are some of the things you can do to stop yourself from scratching. First of all, you can try patting your skin instead of scratching. In this way, you limit the amount of trauma and micro-injury to the skin surface by not scratching, and by patting your skin, you also create a distraction for yourself. You can also keep your nails nice and short to also help prevent further trauma when you scratch your skin. You can also consider wearing cotton gloves at night to stop yourself from scratching, because we know that scratching at night often happens subconsciously. Another way to stop scratching is to find relaxation techniques that work well for you, such as meditation. And lastly, certain psychological techniques can also be quite helpful in stopping yourself from scratching straight away. So this centers around being aware of how much you scratch, replacing your scratching behavior with a more desirable one, such as patting your skin or squeezing a ball every time you feel the urge to scratch, and also being aware and educated on the treatments you can use to help prevent your skin from being itchy. Thank you for watching this video. I hope you find the information useful and educational. If you have suggestions on what I should make next, please let me know in the comment box down below, and I will have a think about it. Thank you for watching once again, and see you next time. Bye!